All right. Thanks so much for being on the Friends with Wheels podcast. My first question that I have for you is, tell the audience a little bit about you and how you got started, and we can go from there.
Yes, I would love to introduce myself to your audience. I'm a clinical psychologist based in Newport Beach, California. I have a dual specialty in couples work and trauma. The majority of the patients we see here are people who are trying to figure out why life isn't going according to their plans and what they can do to modify their felt sense as they come across this mismatch that makes them feel potentially anxious or depressed. We provide all sorts of services from brain mapping to neurofeedback to EMDR, and try to bring as much care and support that we can to our community.
Tell me a little bit about each of those buckets. Tell me a little bit about what you do in the couples aspect of things.
Well, in the couples aspect, unfortunately, most couples don't come to therapy until it's a little bit too late because people start to fight in a relationship. I would say the best kind of care in couples work is preventative care, where you start to work on the relationship before it goes south and develop good communication skills before you end up hurting each other. But if that's not the case and you end up hitting a hurdle and you feel like you have no way to resolve your own issues, we provide a holding environment in which each person can talk about what distresses them and learn good skills in how to express that without hurting the other person and in a way that's more conducive with getting their needs met through their other partner.
And how do you, as a clinician, help couples through that? What do you do to sort of help them talk about their issues in a very safe and healthy way? Because oftentimes that's not always the case. It's always so oftentimes, it can turn violent, or
Yes, you're very right about that. So, to give you an example, one of the things most of us do when we're hurt, even if we're not turning aggressive or violent, is we stonewall the other person, which means we stop talking to them or we ignore
hmm
them or we kind of go into our own inner cave to kind of heal our own wounds. But that could be very stressful in a relationship when the other person is wanting to connect with you and to work through whatever challenges that are present in the relationship. So we kind of teach people the proper skills for expressing themselves in a way that's not threatening to the other person without using hurtful words, learning what to say so that the other person has more availability to listen and to be present with them is extremely helpful.
hmm And what about the work with trauma? What's that all about?
So, trauma is anytime we go through something that our nervous system has a very extreme response to and cannot recover from that. Whether it's a fear response or you kind of get stuck and emotions don't get a chance to process themselves and move through properly. Our reactions to other phenomena in life are no longer just regular reactions. They are based on that previous experience that has us stuck somewhere. All the new research shows that this trauma actually gets stored in the body, not so much in the mind. I mean, the mind carries it obviously as well. But the way to treat it is a combination of talk therapy and body work. So that's where techniques like somatic experiencing or EMDR or even neurofeedback come into um, the therapy room where you teach people to identify the places that have stored emotion in their body regarding that traumatic event, and then give them basic skills to release that tension and work through processing that emotion. Most people tend to hold a lot of tension in their abdomen, stomach area, in their shoulders, or in their chest or throat. So, learning breathing techniques or muscle relaxation techniques as they think about that piece of trauma will help them come to terms with it in a more digested way. Hence, their reactions to their environment starts to become more normal and not rooted in these traumatic events.
Hmm. Yeah, the part where, the trauma is stored in the body, that I did not know. It's interesting.
Yes, if you notice, I mean, I'm sure you've had experiences like this. If there's a loud noise, for example, you might get a startle response, right? That's based on something
Yeah.
that you have experienced before, that has remained in your body as kind of a way to notify you you're in danger, right? But and it's a survival thing, so we all need to have it. But at times, our body misfires because it has been introduced to something that's traumatic. So we're not necessarily in danger right now, but our body feels like we are.
Hmm. So, but when you talk about trauma, is it like trauma from a death of a loved one, or with someone who, because it not only applies to that, it also applies to people who've had PTSD and other stuff. So,
Yes, so trauma can be anything that your particular nervous system has had a response towards that's um, threatening to your sense of safety. It could be the death of a loved one. It could be a car accident. It could be simply recovering from a bad childhood. It could be a dog bite. So we have big T's and we have little T's. Depending on your experience of that matter and how well your nervous system has adjusted to it, that can become a trauma in your life.
and how do you as a clinician help deal with people who've experienced significant trauma, like in the examples that you've said, with like a car accident or like the other examples, basically?
So, depending on how bothersome the traumatic event is to the person, usually about one third of the people who go through something traumatic develop, like you pointed out, PTSD, which is post-traumatic stress disorder. So, depending again on the severity of the post-traumatic stress disorder, some people, for example, if they were in a car accident, they can't get into a car anymore. That's how severe it is. Some people can get into a car, but they're continuously anxious and have shortness of breath, or are continuously thinking about, oh my God, I'm going to get hit by a car again, which impedes their driving. So depending on the situation and the person, you can have a lot of different reactions. We have to assess the person first, find out what the crisis mode is, and get to know their psychology and their typology. And with the combination of both of those, offer them a treatment plan that is suitable for their situation and that can get them out of that trauma response as quickly as possible.
Hmm. And I forgot to ask, what sorts of modalities do you use in the relationship aspect, but also the trauma aspect with clients?
Yes, in the trauma aspect, I would say the main ones we use are somatic experiencing, EMDR, depth psychotherapy, and trauma focused CBT, which is cognitive behavioral therapy. For the relationship models, again, our clinics are very depth oriented, so we do go to your initial beliefs and kind of delve into your unconscious to a good extent. But we use a lot of Gottman work, we use a lot of um, dialogue work to help them develop the proper language to communicate, and a lot of empathic building emotional communication will helps to people kind of exchange information in a very mindful, conscious way.
Hmm. And, what have you learned in doing this kind of work as a clinician, both working in the fields of relationship, but also trauma?
I have learned that being an adult is a very difficult task, and that most of us no matter where we are or what our life looks like, are continuously challenged by just showing up in life every day and fulfilling our responsibilities, and sometimes even tolerating the most basic relationship that we have, which is with ourselves.
Right.
There are days that we are mm, in dissatisfaction even with ourselves. Now, I'm not even gonna go to other people because obviously that makes it more complex. But if we learn how to navigate these dynamics well, if we learn how to listen to the language of our unconscious, if we learn to live life more mindfully, to be present, to take inventory of our emotions, to listen to our emotions, and to learn how to respond to them, the process becomes a lot more enjoyable and easier for us.
What made you want to dive into the world of trauma and or relationships? Was there some sort of mentor that you sort of looked at and said like, "Hey, I want to do this one day," or was there like some sort of class when you were becoming a mental health professional that you were like, "I want to do this"?
Well, there was both. I think I came along people that I very much resonated with as a student that worked in these fields, and they mentored me, and I developed a lot of respect for the kind of work they did, and I became more and more interested. But I would say in my own personal life and in the lives of the people that I saw around me, I noticed that people have the most amount of pain in those two domains, in their relationships when they're not working well, and in their relationship with themselves when they have endured trauma that they don't know it's trauma, but they keep on going through a lot of emotional ups and downs as a result. And a lot of times people blame themselves or call themselves anxious or depressed, where what it really is unresolved trauma.
hmm And lastly, what tips or advice would you give to those who want to study, like trauma or relate or aspects of relationships? So for those who are going who want to go into the mental health field that want to learn, do what you're doing, what would you tell them?
I would say start your work with yourself. You are your biggest canvas in this world, and start by finding a good, essentially expert, a clinician, and start working on your own psyche and understanding yourself and how you show up in life, where your strengths are, where your limitations are, and navigate that, because your psyche is your biggest tool in the realm of becoming a clinician. You're not working with anything else. Any person that you work with has to go through your own psyche. So if you haven't done your own work, you won't be able to help other people.
All right. Okay. Okay.